Welcome back. Let's start by practicing the deep breathing skill we learned in the first session. First, let's take a thermometer reading of our current anxiety level. On a scale of 1 to 10, 1 being very low to non-existent, and 10 being the most severe anxiety you've experienced, where are you right now? Please jot down what your number is right now. Okay, now let's take some deep breaths. Taking a deep breath in through our nose, counting in our mind 1, 2, 3, 4, imagining the air we breathe filling our stomach, holding for a count of 2, then breathing out through our mouth for 1, 2, 3, 4, and pausing before we start again. Now let's all try. Breathe in for a count of 4, hold for a count of 2, and breathe out for a count of 4. Let's try it again. Breathe in for a count of 4, hold for a count of 2, and breathe out for a count of 4. Okay, now let's take a new thermometer reading. Please rate your current level of anxiety on the scale from 1, very low to none, to 10, most severe. Did you notice a shift in your number? We will begin by summarizing what we have discussed in the past 2 sessions and reviewing your homework. Then we will shift into today's topic, which is focused on cognitive restructuring and self-care. We'll wrap up by putting it all together and creating an action plan for managing your anxiety. During the last 2 seminars, we discussed the interactions between the 4 anxiety symptom clusters, which includes thoughts, feelings, behaviors, and physical sensations. Learned about automatic thoughts, began to identify and address unhelpful thinking styles. We have been using the cross-sectional formulation worksheet to help solidify these concepts. Okay, so now we're going to transition into taking an alternative look at the cross-sectional formulation. By now you are all probably experts on the cross-sectional formulation and can probably explain it to your friends. But let's take another look at it before incorporating the next component. You begin the simple cross-sectional formulation by identifying an anxiety-provoking event and then noting the interactions of your experiences of anxiety symptoms. We have found that the cognitive component is heavily weighted, such that the way you think about or interpret a situation can perpetuate the anxiety and then trigger other symptoms. We spent the majority of the last session talking about the impact of automatic and unhelpful thoughts. You may be asking yourself, so now what? What do I do about it? Remember that we have done 2 activities to address the physical symptoms directly: deep breathing and progressive muscle relaxation. And that by addressing the physical symptoms directly, you are freeing up mental energy to address other symptoms. Also remember that completing the cross-sectional formulation is a tool. It requires that you slow down and detangle the symptoms you are feeling. So now let's focus on how to address the thoughts directly through cognitive restructuring. What we mean by cognitive restructuring is to take a different thinking approach to the anxiety-provoking situation. This involves purposefully slowing down, challenging your automatic and unhelpful thinking patterns, and giving yourself a broader perspective on the situation. This takes time and lots of practice, so be patient with yourself. Here's how it works. When you start to notice anxiety, think to yourself, stop, pay attention, and get perspective. This means stop, pay attention to what is going on in your mind and body, and then be intentional about what happens next. What we want to do here is to slow down the process so that you don't get caught up in the anxiety and so that you feel more in control. The ultimate goal is for the stop and pay attention mantra to become second nature, so that you use it even before experiencing anxiety. That is going to take time and lots of practice. To better understand this stop and pay attention mantra, let's work through an example of alternative responses to anxiety. I want to highlight that when we are doing the alternative responses, we are not saying, just think positive, because you have probably heard that before and it's not that simple. What we are saying is, let's look at the situation from a broader perspective. For example, using the same anxiety-provoking situation of being invited to a party and feeling anxious about going, one of the alternative responses is, I might still have an okay time. It is important to remember that you're probably not going to jump from the thought, I'm going to have a terrible time, to the thought, I'm going to have a blast. Make sure your alternative thoughts are realistic and believable. Don't try to just jump to the positive extreme, as this would be an example of an unhelpful thinking style of black and white thinking. We will be filling out an alternative response worksheet, which corresponds to an anxiety-provoking event from one of your homework assignments. Fill out the blank alternative response worksheet on page 32. See the example on page 29 of your workbook that relates to the party example, and use pages 30 through 31, titled If You're Having Trouble, Ask Yourself These Questions, as a guide. These questions are intended to guide you to think of alternative responses until they become second nature, which is going to take a lot of time and practice. So we've spent a lot of time talking about thoughts. This is only one of several ways to cope with your symptoms. Let's shift into other strategies you can add to your toolbox. Let's start with a technique called grounding. Grounding is a recentering technique used to pause, refocus, get unstuck, and come back to the moment. It's a sensory experience that you can use anywhere, anytime. We're going to practice one technique together. This technique is called the 5-4-3-2-1 technique. Without saying it out loud, observe 5 things you can see in the room. Observe 4 things you can feel, such as the chair on my back or my feet on the floor. Observe 3 things you can hear right now. Observe 2 things you can smell right now. And think of one good thing about yourself. That exercise may have resonated with some of you and not with others. Remember, not every coping strategy we teach will automatically work or work in every situation. It takes practice to figure out the tools that work best for you and in which circumstances. What we hope is that you are creating a toolbox for anxiety and using the tools you need when you need them. You get to choose what you put in that toolbox and what you take out of it. In your appendix on pages 41 through 42, there's information about a number of other grounding strategies to try and add to your toolbox. Take a moment to review these pages. Star, highlight, or circle all of the potential strategies that could work for you. Another aspect to keep in mind while focusing on addressing anxiety is your overall self-care. Like we talked about in the first workshop, sleep hygiene is one of the best self-care strategies because it affects everything else about your health. In addition to practicing good sleep hygiene, exercise, a balanced diet, minimal caffeine use, and pleasurable activities are also important in maintaining a healthy mind and body. Page 35 of your workbook provides information on pleasant activities that can also be used for self-care and as coping strategies. Take a minute to review the sheet. As you review the worksheet, highlight or circle the information that you believe you could start to incorporate into your daily or weekly routines. Now let's begin to put everything we have learned into an action plan for managing anxiety. On pages 36 through 37 of your workbook, there is a worksheet with a number of questions about recognizing symptoms and triggers and implementing some of the coping strategies we've discussed. Go ahead and review these pages now and feel free to get started. The sooner you complete your action plan, the sooner you can implement it. Before we conclude, let's take a moment to figure out how you are going to remind yourself that you have a plan for managing anxiety and that you have set goals. It may be helpful to review your plan in the morning, before you go to bed, or before an anxiety-provoking situation. Some people find it helpful to take a picture of their plan and have it easily accessible on their phone. You could write post-it notes of your goals and keep them visible. Maybe you could ask a friend to check in with you about your goals. Think about some ways that you can remind yourself about your plan. Please write them on the bottom of page 37. Okay, so let's talk about what we learned in these 3 seminars. We discussed anxiety symptoms, focused on the ways in which thoughts, behaviors, feelings, and physical symptoms interact. We also increased awareness of your triggers and unhelpful thinking styles, and identified coping strategies for dealing with these symptoms. Remember that we have to practice these strategies regularly to effectively manage anxiety. Remember that some amount of anxiety is normal in the human experience. With consistent practice, the coping strategies that we learned in this seminar will help maintain our ability to manage anxiety and prevent feeling overwhelmed from anxiety. We discussed a personalized action plan to continue to practice in the future. Make sure to use your plan even when your anxiety is low as a maintenance measure. In fact, it can be more helpful to practice when your anxiety is low, because practicing when your anxiety is low makes the skills become more second nature, so that when you do feel anxious, the skills come more easily. After we conclude today, please take a moment to visit the link below or at the bottom of page 3 or page 44 of your workbook to complete an evaluation form and let us know your thoughts about this workshop series. Remember that you can come back and use the tools in the Anxiety Toolbox workshop again and again. Please contact us if you have any questions regarding this workshop, would like to know about additional workshops, or are interested in making an appointment. FAU Counseling and Psychological Services would like to acknowledge and thank our colleagues at Counseling Services, California Polytechnic State University, San Luis Obispo, for so generously sharing their Anxiety Toolbox program with us. Thank you for your participation.